So excited to have you on. I've heard a lot of famous things. They call you the disciple around here.
Thanks.
So they say that, the patients say that once they see you, they don't go anywhere else. There's something special about what you've been doing. I don't know if it's all your school, your education or what, but why don't you tell us a little bit about yourself? Where did you go? What's your education? What's your family from? All that stuff.
So I grew up in New Jersey. Both my parents are doctors. I come from a family of doctors, multiple generations. Just kind of watching my parents as a kid, and seeing their devotion to their work and their patients. And we grew up in a small town in New Jersey, and we'd see their patients out in the community, like at a restaurant or at the grocery store. And it was always nice seeing that relationship that they had with their patients. And so I knew at a pretty young age that medicine was something that I was really strongly considering. And when I went to college, kind of further that interest in science and medicine. And then in med school is when I decided to do ophthalmology. I love that there's there's a lot of technology involved. There's surgery. There's kind of patient care and interaction. You get to develop a relationship with patients over years. And I felt like ophthalmology was just kind of the perfect mix of everything for me. Um, so I did my medical school at Johns Hopkins, residency there as well. I did a 1 year fellowship in cornea and refractive surgery and glaucoma surgery in Minnesota. I finished that in 2010. I spent a year in practice in California before moving down to South Florida in 2011 and opening up URI specialists with my brother-in-law, Dr. Vidula. That was 2011.
What's one of the big things that has happened since 2011 for you guys that you would have never expected to happen?
To be honest, I didn't expect to be, 12 years later to have, multiple office locations, multiple doctors in our group. And, things have just really grown organically. And I think that has a lot to do with kind of the quality of the care that we provide, that the patient experience. We're a family. We're a family of doctors here, but even everyone else here, the other doctors, the staff, we really consider ourselves a family. And I think even though we've grown to having multiple locations, we still kind of project that vibe to our patients. And I think that they feel like we treat them as individual patients and can really customize the care that each patient receives.
One of the things you said there was that you guys have multiple offices. What is one of the big benefits, or what are some of the benefits how that helps the patients? That the size of what you guys have done, the doctors that you guys have in your network, and all of that. How does that help your patients?
Personally, I enjoy going to different offices. Every office is different, and it gives me exposure to different patients. But it really allows me to kind of focus on like my specific subspecialties and expertise. I enjoy doing cataract surgery and LASIK surgery, but also treating surgical and medical glaucoma and cornea. And I think by traveling to the different offices, I'm able to provide that service in different locations. Whereas I think if I was just in one office, I'd be doing more kind of comprehensive ophthalmology and general exams. And so I think it's allowed each of our doctors to really kind of focus on what they specifically enjoy and excel at, and so I think that's been a big plus.
Absolutely, and I love that because it's like not only are you guys have within your own group circle all these different types of doctors that if you need this specifically, we got you from that standpoint. The way you guys can help each other, I think one of the things I saw earlier today from being around you guys in the office was how you guys bounce back ideas to one another, and how you're able to, if you're not sure about something, you have such, and not just generic doctors, but such world renowned, such high educated doctors that you can kind of reflect with and make sure that it may be the best treatment. So I found that really interesting today when I saw that. So
Yeah, and I mean, we certainly have within our group, just by the growth that we've had, we've been blessed to be able to provide, all different types of services. So we have, oculoplastics, we can, treat eyelid issues. We've got, retina doctors. We've got, glaucoma, cornea surgeons. We've got optometrists. So, kind of the full spectrum of services. But, a lot of times, we might have complicated patients with complicated eye issues, and so we all work together as a team, and so someone who has a cornea issue might also have an eyelid issue, and so it's nice to be able to kind of work with our colleagues within the practice and work together in cases. So we certainly have the opportunity for that.
No, that's awesome. That's awesome. And you mentioned there so many different subspecialties of ophthalmology and services of the eye. Why did you choose yours? Like, what's your story there?
First, just choosing ophthalmology, as I mentioned. I mean, I love the technology, just the ability to improve patients' vision. And so when I was a resident, uh, I knew I just gravitated toward cataract surgery, and I looked at other specialties like retina, even oculoplastics. But for me, like I knew if I were to go into one of those other subspecialties, I wouldn't be doing cataract surgery. And so that's kind of why I decided to do cornea and refractive surgery, because I also enjoy doing cornea transplantation and things like that. But it gives me the opportunity to continue to do cataract surgery, and then to bring that expertise in terms of managing corneal issues that can complicate patients' vision outcomes after cataract surgery, and to kind of really optimize our outcomes by considering the cornea as well.
Is there anything specific why you love the cataracts?
The technology. I mean, the surgery itself. When I'm doing cataract surgery, I really don't consider that I'm working. It's just fun. But also just the technology that we have available, and that technology is constantly evolving. In terms of lenses that we use. I finished my training in 2010. Some of the lenses that we used, which we call like lifestyle lenses, multifocal lenses that we used back then, they're obsolete now, right? So, there's always these new lenses, and so, being able to bring that to patients, and to offer them, the latest technology, and get the best outcomes, that's just been really attractive to me.
With everything from, one of the things that really stands out, I think, is when I look at your resumes, the schools you attended in the your residency and all that. What are some highlight points of how you feel like those schools made you the doctor you are today, or how that journey has kind of shifted and molded you to become?
I think just from for example, from residency, my program, we had exposure to some really significant complex cases. Patients were referred from all over. And I think just having that exposure, having that comfort level with complex cases really makes the kind of the run of the mill cases just that much easier to manage. And so I think that was a huge plus. But also, if there is a complex case out there, we have the skill set to be able to address that as well.
With everything that you've mentioned and all your experience with cataracts, there's a lot of people out here that, and probably a lot of our audience or anybody who's searching to figure this out. What is cataracts, and specifically, what is premium cataracts?
So, cataracts are an age-related clouding of the natural lens in the eye. And so it's something that's unavoidable. And at some point, a patient's cataracts will be significant enough that's affecting their quality of life. So, they might limit driving. Maybe they don't drive at nighttime as a result of glare that they're experiencing from their cataracts, or they're just not comfortable reading anymore, or watching TV, or, going to movies or shows, and, not being able to see and enjoy those things, or sports, whether it's playing tennis or golf, and being able to follow the ball. And so those are things that patients will complain about with cataracts. And so, when you look at the evolution of cataract surgery, maybe 30 years ago, the treatment was just to remove the cataracts, and then to provide patients with glasses, and that was considered a successful outcome. But nowadays, surgery is just more demanding. Patients' expectations are more demanding, and we want to be able to meet those expectations. So patients want to be able to do everything that they like to do, whether it's read, or drive at nighttime, or play sports, and not have to be dependent on glasses. And so that's really where the evolution of cataract surgery has come. And we're seeing constant improvement in the technologies that we have available to provide patients better vision to support their active lifestyles. So when we talk about premium cataract, what we're talking about really is these multifocal lenses, or lenses that provide patients independence from glasses. And so first, of course, we want to make sure the patient has a cataract, and then Once we establish that, we always do a thorough eye exam to make sure that there isn't any other ocular issue that would potentially affect outcomes. So if someone has, say, macular degeneration or glaucoma, then a premium lens or a lens that provides a range of vision multifocal lens may not necessarily be a good choice for a patient. So it's very important to do a thorough eye exam just to rule out any other potential ocular issues.
Absolutely. And there, what is the difference between regular cataracts and premium cataracts? How would you explain that to someone?
So, with premium cataracts, we're really focused on getting the patient as close to, say, 20/20 perfect vision, giving them a range of vision often. So, if a patient wants to be able to see distance for driving or see their phone, go out to dinner and see a menu without needing glasses. That's kind of what we consider premium cataract. So a lot of it has to do with what the goals of the patients are. So in order to provide that spectacle independence, I would say that's really the difference between regular cataract surgery and premium cataract surgery.
Okay. What about with premium cataracts? What is the process like for that?
So it's a multi-step process. We do an evaluation with the patient. The patient will meet the surgeon, so they'll come and meet me on the day of the evaluation, and I walk them through the procedure and make sure that there's no other ocular issue, or if there is, we'll certainly address that and talk about that. And then we talk about the patient's goals. So is the patient's goal to see far away? Do they mind wearing glasses? Do they want to be free of glasses? Do they want to be able to drive at nighttime? Are they worried about potential for halos at nighttime? And so we talk through that so we can really kind of determine what the best lens for that patient is, and kind of come up with a treatment plan together. Once we decide that the patient is ready for cataract surgery, and most of the time, we leave that decision up to the patient. A lot of times with cataracts these days, the time for surgery is really when the patient feels like they're just not comfortable with their vision. Um, Now, certainly, if a patient is driving and their vision doesn't meet the requirements for driving, we would let them know. But if they don't feel comfortable with their vision and we decide to proceed with cataract surgery, then they'll meet with their surgical coordinator. The surgical coordinator will then help to set up the date of surgery, a separate date for lens measurements, because we do that on a separate day to make sure that there aren't any drops in the eye or any other issues that would confound our results. We really want to get the best measurements so we can get the best outcome. So there's a couple of visits before the surgery, but usually once we see the patient, we can schedule the surgery within a couple of weeks.
Patient shows up, day of surgery. What happens there?
So the patient shows up to the surgery center. So we have several surgery centers that we use, and so we'll often try to find the one that's most convenient for the patient. But the patient will show up to the surgery center. Of course, they register. There's always some paperwork. We try to minimize that and get that done as much as possible ahead of time. But once they're registered and brought back to the preoperative area, they're given an IV so we can give them medication to help relax them. Lots of drops to prepare the eye, so dilate the eye, numb the eye. And then once they're ready, then we go back to the operating room. The actual procedures, 10 minutes or less. There's an operating microscope, so patients are not fully asleep during that procedure. We do need them to look at a light and to have them look in certain directions, but they do get sedation through the IV, so they're nice and comfortable. And really, there's no pain involved. A patient may experience some pressure around the eye at one point, maybe a little burning sensation. They'll feel lots of fluid on the eye, but they're very, very comfortable. After 10 minutes, the procedure is done. We'll put a clear plastic shield over the eye so patients can see right away. And they have to start some postoperative drops, but they go home that same day within a couple of hours from arriving at the center.
Okay. And then how often do they have to come back to see you? What's the follow-up process like?
So follow-up usually involves 3 postoperative visits. So there's one the first day after surgery, a week after surgery, and a month after surgery. And we just really want to make sure that the eye is healing along its expected course. If we're doing 2 eyes, we usually separate the 2 surgeries by 2 weeks. That allows the first eye enough time to heal before we do the second eye. One of the questions we often get asked a lot by patients is, why can't you do both eyes on the same day? And it is possible, but we don't encourage that. We don't do both eyes on the same day within our practice. I think for us, we find that it is nice to allow that first eye to heal before doing the second eye. I think it gives patients a comfort level. I think if, there's always a little blurriness after surgery. So, imagining doing both eyes on the same day. And, uh, and the second thing is, when we're picking a lens and putting a lens in the eye, the outcome does depend on how the patient's eye heals. So, oftentimes we can use that first eye outcome to tweak what we're doing with the second eye. So it does give us that opportunity.
Wow. I didn't there's so much more to that than like it's really cool to see how you guys personalize everything. Like it's really listening to the patient, seeing making those fine-tune adjustments. That's unique. Yeah.
Yeah, it is important. So, I mean, so we'll have patients sometimes that will, they'll for the first eye, they'll elect not to do a multifocal lens. So they'll just do the distance lens. And then, when it's time for the second eye, they'll come back and realize, you know what, I really want a little more near vision. I want a little range of vision. And then we can certainly, within our armamentarium of lenses, we can pick something that, we know that will give them a little more range of vision and that will work well with the other eye.
That's fascinating how your field has like evolved so much. Like as you were mentioning there from so many different times, like what we did 10 years ago to what we did 5 years, like the exponential leaps that are happening specifically in your field from what I hear is it's pretty astounding.
It is, nowadays, in terms of, for example, with cataract surgery, uh, most of our patients are electing to have cataract surgery with the assistance of a laser. So that's the other part of premium cataract surgery that we didn't really touch on. I know we talked about the lenses, but the laser has really been around for the last 10 years or so, and it does help to provide some increased precision, for some cases, increased safety, even does help us to provide a little bit better vision outcome because it can treat some astigmatism as well. So, when I was in training as a resident, the laser was not something available. So there's always new technology coming out, and it's very important for ophthalmologists in general to just be on top of the new technology and constantly incorporating the technology into their practice.
No, absolutely, absolutely. One thing that I forgot to ask you, the follow-up process of cataracts, and from the recovery standpoint specifically, what is that looking like for the patient?
So, patients have to use drops. There's a tapering schedule with drops over the course of a month. For the first week or so, we kind of have patients take it easy. So, no lifting more than 15 pounds, no swimming, but they can do most normal activities. Many patients feel comfortable enough even driving the next day, using the computer, watching TV, even the same day of surgery. They're certainly not harming their eye using the eye, but there might be some blurriness, a little light sensitivity at first for the first few days. It is a very quick recovery process, though.
So one of the things that I find really unique as well is the patient coordinator, the amount of time that they spent with the patient and the detail that you guys have for that. Can you talk to us a little bit about that?
Yeah, I mean, I think we've got a great team. In each office we have a dedicated patient care coordinator that meets with the patients and kind of helps to review lens options, laser options for patients, and then is kind of their point person throughout the whole experience. So, we'll often see that at the end of the whole experience, our patient care coordinators are getting gifts from our happy patients, and I think they do an amazing job. They call the patients a lot of times. They'll talk to the patients ahead of time. And it's usually the same individual. And then they meet the patient on the day of their consultation. They see them again when they come in for their lens measurements. And we'll often see them postoperatively as well to kind of follow up with them. So they're really an integral part of the whole experience that we provide for our patients during the cataract or LASIK surgical process.
And that's so important, right? Because I'm sure all our patients are going to have questions at certain point, but them knowing that they have a go-to person that they can contact if they're concerned, have a question, whatever the case may be, boom, it's right there. That's huge.
Exactly, and then the patient care coordinator is always in direct contact with the doctor. So a lot of times they've connected us. So if a patient has additional questions after their initial consultation, after their measurements, and they want to speak with the doctor, we've always been able to really help make sure that there's good communication.
So one of the questions that when I started to do my research about premium cataracts was patients were asking if they can feel the lens in their eye now. What is that?
I get that a lot. I think, when we talk about lenses, and a lot of times patients are, very familiar with contact lenses. So, they're wondering, once you take out the cataract, you're putting a lens in the eye, and they think it's like a potentially like a contact lens, and can I feel that? But no, the lens is inside the eye, and so it's not something anyone can feel. Now, of course, postoperatively, as the eye is healing, patients may feel like a feeling like there's something in the eye, a grain of sand, or something like that. And that's usually just because the surface of the eye is still healing. But it has nothing to do with the lens implant itself. So once the eye is fully healed, it's not something that a patient can feel.
So, when you were even mentioning earlier a little bit about the process for the recovery for premium cataracts, do they really go blind, or is it like, how does that work? Up to what point do they see? Like, that was something that I saw a lot of questions as well.
Yeah, patients can see right away. It's of course blurry at first until the eye heals. The nice thing about the technology is that the way we numb the eye, patients can see right away. With some older techniques for numbing the eye, it would block the vision out for 4 or 5 hours, and patients would have no vision. We would patch the eye overnight, but really within the last 20, 30 years, the evolution of cataract surgery has been that we use just really minimal anesthesia on the eye itself. So we don't block out the vision. We just really provide comfort to the eye. So patients can see right away. It is a little blurry at first. I like to use the analogy of, say, like bumping your knee or elbow. You're not going to have swelling right away. Usually it takes 24 to 48 hours. So same thing with the eye. Right after surgery, sometimes patients will say, they can see, and then it gets a little blurry the next day, and then it starts to clear up, and that's kind of the normal course of things. But they'll have reasonable vision that they can see immediately after. Most patients go home and watch TV and just kind of relax at the rest of the day.
And is it painful?
It's not painful. So, of course, I think it's scary, the thought of having surgery on your eyes. I think for most patients, and, even we have a lot of physician patients, and I think that there's just a lot of fear and anxiety about having a procedure on the eyes, but there's no pain. Of course, patients can feel things during surgery. They might feel there's a little clip that we use to keep the eye open, so they'll feel a little pressure on the eye, a little water, fluid on the eye throughout the procedure, but there's no pain involved. I think it's the anxiety of having the procedure that really can be the biggest issue. And you'd be surprised by how many times, like, after surgery, once we're done, patients will say, "That's it? I didn't even know you started." Right? So it's such a simple procedure.
No, and with that, one of the things that I also started to see is people always asking, it's risky. I don't know if it's worth it. How risky is it really?
There's no surgery without risk. So, there's always risk involved. And so, when we're deciding to do cataract surgery, of course, we want to make sure that the surgery is needed and that the patient is going to benefit from the procedure. But the risk is exceedingly low. The risk of anything serious, a serious complication, is less than 1%. There's always a risk of infection, but the risk of that is 1 in 1,000 or less. And if kind of picked up early postoperatively and treated early, patients can have a good outcome, even if there is an infection.
No, none of the other things that I would see often is that, do patients have to get cataract surgery multiple times in their lifetime? Is it something that they can get again if there happens to be something?
That's a very common question. So, cataracts don't come back. There is a phenomenon that we call secondary cataract. And so, if you're looking online, you'll certainly run across that. But it's not the cataract coming back. What it is when we do cataract surgery, the lens implant is placed in a structure we call the lens capsule. That's actually part of the original cataract. It's a very thin, clear membrane, and that's what supports the lens. Over time, that lens capsule in some patients can get cloudy, and it could be months or years after surgery. But if patients do develop the secondary cataract, it's a very simple. There's a very simple laser procedure in the office that we can do to treat that.
And one of the things I also saw often was that they were asking if the technology, if the new lasers, if the evolution had made a difference. I know we mentioned a little bit, but in specifically with cataracts and with premium cataracts, how has the technology and specifically what we use here at Your Eye Specialist, is it better? How good is it? How much of a difference does it really make from traditional? Like,
Mhm.
I'm sure you may get some of those
We
questions.
do. I mean, and traditional surgery, is excellent surgery. It's there are great outcomes, decades of literature on the outcomes, and patients do well. But we're a technology driven practice, and we do believe in the technology that we offer, and so for us it's really important for us to constantly evaluate new technologies and determine if there is an improvement over preceding technologies and then incorporate them into our practice. So, we do find with this, especially with the lens implants, the technology is always evolving. And so, we're getting better and better technology. And so for us, it's a very important part of what we do.
So one question I also saw often was after getting premium cataracts, after getting cataract surgery, that you're going to see 2020. Is that the case? Is that not the case? How does that work?
That's a great question. I mean, that's always our goal. We want to provide patients, the best vision, and certainly some patients do better than 2020. And you know what 2020 is? It's just really that level of vision, that a certain line on the chart. And so some patients can see better than that. Sometimes some patients don't quite reach that. And our goal is really to optimize the vision. So if a patient doesn't quite achieve that outcome, we want to figure out why. And most of the time, it's really dry eye, and dry eye can be very dry is very common, and surgery can exacerbate it. And so within our practice, that recognition of dry eye and early treatment, even preoperative treatment, is very important. So we have incorporated a process we call optimization. So if we see any signs of dry eye, we'll treat that aggressively before surgery. So we work closely with our team of optometrists in the practice to really get that under control first, for two reasons. One, if that dry eye is under better control, we get better measurements. And two, we get better outcomes in terms of vision and better patient comfort postoperatively. We really want to treat that ahead of time. Now, if a patient does develop worsening dry eye after, that's affecting their vision, where they're not quite 2020, we try to treat that as best we can to really get the vision under control. Now, cataract surgery, of course, is not an exact science, so we do our best with the measurements. But there are some patients where you may end up a little off target. Every eye heals differently, and so you do have to take that into account as you're planning a patient's surgery. But if a patient does end up off target, then there are things that we can do to kind of fine tune or adjust. So we could do some laser vision correction or LASIK afterwards to really fine tune that vision and get the patient to 2020. So we have all these tools available to really optimize a patient's vision, and we obviously want to get as close to that 2020 target as possible with just the cataract surgery. But if we need to do something additional, we have that available to us.
That's interesting. I didn't. So you can get cataracts and LASIK,
There are
not
some,
preferably, but
right,
that
not
is a thing.
right. So we will do laser vision correction, LASIK enhancement. We call it an enhancement on a patient to really fine tune if they're not quite where they want to be. So for us, if a patient ends up off target, and I know, of course, we're not the ones living with that. Level of vision, but it's extremely frustrating for us because our goal is to really get patients to where they want to be. And so we'll do our best to really optimize the vision postoperatively.
No, that's interesting because I saw that question asked often from both sides. If I have cataracts, can I get LASIK? But
Right.
I'm glad you
Right.
brought
So
that
so
up.
yeah, usually if we are doing LASIK after someone's had cataract surgery, we call it an enhancement. It's really to fine tune the vision. So sometimes if there's maybe some residual astigmatism or something like that, that's limiting the vision to some degree, we can treat that. Now, the other question that you had asked is, well, if I've had LASIK before, can I have cataract surgery? And of course, nowadays we're seeing more and more patients who have had LASIK maybe 20, 30 years ago and are developing cataracts. And so the actual surgery is no different if you've had LASIK. What is more complicated is the lens selection. Um, some of the lenses that patients really like, the trifocal lenses, these lifestyle lenses, may be contraindicated in a patient that had LASIK. And so we really have to make sure that we assess what type of effect the LASIK has had on the patient's cornea, how it's affecting their corneal curvature or other factors, to really be able to pick the best lens for a patient. So we have a lot of options. We have what we call extended depth of focus lenses. We have the light adjustable lens. and many other options that work really well in patients that have had LASIK before.
As you were mentioning, there was experience, there were so many different variables there. What do you think makes a good premium cataract or cataract surgeon? What is it that, you've realized over time differentiates one from the other? Or, what are some things that if I were to be getting cataracts, I should be thinking about?
A lot of it has to do with the doctor's experience. A surgeon that does a lot of cataracts. In our practice, we have several surgeons, and on average, each of us may do 20 plus surgeries in a day, which certainly sounds like a lot, but you do want to make sure that your surgeon is doing a good volume because the surgeon that does a lot, certainly has a lot of experience. Does a wide range of cases from more straightforward ones to more complicated ones. But also, it's important, word of mouth. If you've had friends who've had surgery and good outcomes, you want to talk to your friends. You want to talk to other doctors. I think we've kind of built a reputation in this community as being the doctors' doctors. A lot of doctors here will come to us specifically for their cataract management, and so I think it's important, to kind of ask your doctor, and ask your friends, and uh, meet the doctor. I think it's important to have that comfort level when you meet the doctor, and here we do all of the surgeons do all of their cataract evaluations themselves, and I think that's super important.